We're going to move on to the next item of business, however, which is consideration of Business Motion 21719 in the name of Graham Day on behalf of the Bureau, setting out a revision to this week's business. Could I call on Graham Day to move this motion?
Moved, Presiding Officer.
Thank you very much. No member wishes to speak on this motion. The question, therefore, is that motion 21719 be agreed. Are we all agreed? Yes. We are agreed. Thank you. So we're going to turn now to topical questions. Our first topical question today is from Rona Mackay.
Thank you, Presiding Officer. To ask the Scottish Government what discussions it had with the UK Government regarding the change of guidance being issued to the public in England. Cabinet Secretary John Swinney.
Presiding Officer, the Scottish Government had no prior sight of the details within the Prime Minister's statement, the document published yesterday, the proposed level system or the change in message. Over the course of last week, following requests by the devolved administrations, discussions were held with Michael Gove and Boris Johnson, in which respective views were shared on changes in regulation and guidance that may take place in each nation, but at no point was the detail of the proposed level system or the change in message shared with the Scottish Government.
Rona Mackay.
Thank the Cabinet Secretary for that answer. We know that the R number is still uncomfortably close to 1 in Scotland at the moment. Does the Cabinet Secretary share my concern that the UK Government's failure to make it absolutely clear that the changes to guidance that we're announcing applied only to England was irresponsible and could result in the virus taking off again here if people don't adhere to Scottish Government guidance?
Cabinet Secretary.
I think it is really important that people understand, and I've seen a number of broadcasters make this point expressly clear in their communication of the Prime Minister's message, that the changes that were announced on Sunday by the Prime Minister apply to England only, and they do not apply here in Scotland. The similar position to that of the Scottish Government has been taken by our counterparts in Wales and Northern Ireland, who have all maintained the same headline message of stay at home, which sums up the strategy of the Scottish Government. I think it's important that members of the public are clear here in Scotland that the guidance and the approach set out by the Scottish Government is the one that applies here in Scotland, and that applies to anybody in Scotland, whether they live here or they choose to come to Scotland on any particular occasion.
Rona Mackay.
Thank you. Can the Cabinet Secretary give an indication of the preparations the Scottish Government is making in advance of the gradual easing of restriction when the infection rate becomes low enough for it to be safe to do so?
Cabinet Secretary.
Presiding Officer, the Government is working across all policy areas on the issues that are relevant to the question that Rona Mackay asks me. There is work going on throughout the areas that are reflected in the framework for decision making, which we will come on to debate later this afternoon, looking at the issues that are relevant in relation to the non-COVID health harms that are existing within our society today, to the social harms arising out of COVID and the economic harms, and how the Government collectively sets out a path will reflect the consideration that we give to all of the issues that are raised within those areas of policy. My colleagues in the Cabinet and Ministerial team are engaging with all of our different sectors, the Economy Secretary with the business community, myself with the education community, the Health Secretary with the health community and the relevant trade unions, the Infrastructure and Transport Secretary with our transport providers, right across the Justice Secretary with the Justice community, to make sure that we understand all of the very careful issues that will have to be considered as we ease the constraints under which we're operating. But I stress that can only come when we are in a safer position to do that in the forthcoming period.
Colin Smith to be followed by Mike Rumbles.
Thank you, President Officer. The Cabinet Secretary says that the guidance only applies in England, but of course this will have a massive impact on my constituents in the south of Scotland, the many thousands of which work in Cumbria and Northumberland. And one of the impacts will be, particularly for those who have children, and I wonder if the Cabinet Secretary is considering reviewing the current criteria for key workers. So those workers that live in the south of Scotland but now are being told to go back to work in Cumbria can be added to that list so they can access childcare. If it's still the position that that should be left to local authorities, I wonder if consideration will be given to providing those authorities in the borders and Dumfries and Galloway with the additional resources to make sure they can cater for what will be an increase in demand for childcare.
Cabinet Secretary.
As I'm sure Mr Smith is aware, the provision for early learning, childcare and educational support for children and young people across the country there has been more capacity than what has been utilised by the number of individuals who have come forward for that support. So I think on the point of resourcing, there is surplus capacity that is not currently being utilised. Mr Smith's question raises some of the sensitivities that are inevitable in the decisions that have been taken by the United Kingdom government as they apply to England, because as a consequence of those decisions, they put members of the public who perhaps are employed in England in the rather invidious position of being more obliged to go back to work than they may feel is appropriate at this particular time. That's a circumstance where individuals should discuss that with their employers. If they are key workers, there are of course education and childcare support available in the Borders and in Dumfries and Galloway. But fundamentally, my point is maintained that people in Scotland should take as their reference point the guidance that's been put in place by the Scottish Government.
Mike Rumbles to be followed by Alec Rowley.
Excuse me. As I understand it, the government doesn't know what the R number is in Scotland, and isn't that due to not enough testing being done throughout Scotland? We have an increased capacity. As I understand it, correct me if I'm wrong, we're not using that capacity. So when will we be using the capacity to the full and then increasing it so we actually can find out what the R number is? Cabinet Secretary.
But the R number, whether it's in Scotland or in England, is considered within a range of numbers between, and it's currently estimated in Scotland to be in that range between 0.7 and 1. There is testing capacity available in Scotland in excess, with an increase of in excess of 10-fold since the start of the COVID outbreak. The Health Service and those delivering the tests are working extremely hard to make sure that we maximise the number of people coming forward for testing. It's an essential part of our strategy, and we encourage and motivate individuals who fit the criteria to come forward for testing to enable us to use that capacity to the full, which is part of the objectives of the government.
Alec Rowley.
Presiding Officer, for the clarity from the Deputy First Minister today, because the statement from the UK Government and the Prime Minister led to, and I think is creating confusion. So it's important we have clarity in Scotland. But can I ask this week Todd and Duncan, the Lochleven Mills, reopened, and many of the workers there have been concerned. Is the government having talks with the trade unions to look at a process that will reopen workplaces over a period of time and do so safely? But more importantly, how do we then police that to ensure that those safety measures and distancing, etc., is in place in particularly non-unionised workplaces where health and safety reps are less likely to be present?
John Swinney.
Mr Rowley raises a very significant issue, and it's timely the Economy Secretary has just arrived, because the Economy Secretary is involved in detailed discussions with employers and trade unions on exactly the question that Mr Rowley raises, because what the objective of the Economy Secretary is to put in place the guidance and the framework that, when it is reasonable and permissible within the assessment of the public health issues for employees to return to work, they can do so with the assurance that they are returning to a safe working environment, where social distancing will have to be a present characteristic in the design of the workplace. Now, that will be very different to the design of workplaces that was in place before COVID, or it certainly should be, to enable social distancing to be undertaken. Now, on the question of policing that, I think we are literally talking about an issue which is down to workplace by workplace, business by business, which brings in the importance of companies exercising responsibility consistent with the guidance that the Economy Secretary is developing with trade unions to make sure that they are operating within a safe working environment. And I give Mr Rowley the assurance this is a very significant priority for the Government and the Economy Secretary, and one that's been actively pursued in dialogue with business and trade unions.
Thank you. Question 2, Alexander Stewart.
Thank you, Presiding Officer. To ask the Scottish Government what urgent action it will take in light of reports of COVID-19 related attacks on police officers?
Minister Ashton.
Our police officers are on the front line each day to protect the public and to keep us all safe from COVID-19. And no
I wonder if Ms
police
Denham would just lift the
officer
microphone, that's it.
should be the victim of abuse or violence whilst at work. And I support the Chief Constable in describing such behaviour as totally unacceptable. The Cabinet Secretary spoke yesterday to the Chief Constable and also to the Chair of the Police Federation and had very positive discussions with both. It's clear that where an officer does have a COVID-19 interaction, Police Scotland can offer facilities for an assessment and, where appropriate, a test. For those that do assault our officers, the Lord Advocate has confirmed that those engaging in such behaviour will be dealt with robustly by Scotland's Prosecution Service, and the Police and Fire Reform Scotland Act of 2012 enables penalties of up to 12 months imprisonment, a £10,000 fine or both, following conviction for offences of assaulting, hindering or obstructing a police officer. Our justice system also provides for protection for all workers under our common laws of assault, threatening and abusive behaviour and breach of the peace.
Alexander Stewart.
I thank the Minister for her response. Police officers are on the front line enforcing this lockdown, and they continue to do their usual jobs of detecting crime and keeping us safe. And for that, we cannot thank them enough. Unfortunately, some officers report being spat at and coughed at in a disgusting attempt to spread coronavirus. This is an attack on us all. The Police Federation have called for a guarantee that these individuals are not released before appearing in court. Therefore, why have the Crown Office not directed this, Minister?
Minister.
So any police officer, as I've just described, that has a COVID interaction, and if they're concerned about that, which I imagine many of them would be, and even if they're not symptomatic, they can go and speak to Police Scotland HR and they can get access to a test. There's no barrier to accessing testing. And as the member has rightly just said, the police are at the front lines in this. They are out there putting themselves at risk on a daily basis in order to keep the rest of us safe. And we want them to have confidence that if they are concerned, that they can get access to testing. And we would expect them to be able to do that. So in terms of what the member has mentioned on automatic remand and if someone is carrying out an assault of that type on a police officer, I would point the member to the Crown Office and their recent guidelines that were issued by the Lord Advocate. And this was at the start of the COVID-19 outbreak. So he said that liberation is a decision for the police based upon the circumstances of the individual incident, and the police can detain any person to protect the public from risk of harm, and spitting at someone and saying that you have the virus would obviously meet a reasonable description of putting someone at risk of harm.
Alexander Stewart.
I thank the Minister for that response. The Police Federation have also called for routine testing of officers without symptoms who may be spreading coronavirus across communities without knowing that. And when the Deputy First Minister was asked about this yesterday in the radio, he did not respond. He didn't take that forward. So can I ask, therefore, can we get a straight answer from the Minister today that police officers who are putting themselves at risk will receive tests?
Minister Ashton.
Yes, I'm happy to go on the record today and say there is no barrier to accessing testing for police officers or staff. So any police officer or member of staff who is concerned about their health or their well-being following an assault of any kind to do with the COVID-19 situation that they're in at the moment, what they need to do is they can contact Police Scotland's HR department to be risk assessed, and then following that a decision would be made on whether testing is appropriate for that individual. So we have been working with Police Scotland since the 6th of April to ensure that officers and staff can access testing. That's a number of testing sites to ensure that those who can be tested are being tested. And Police Scotland HR are now able to risk assess any officer or member of staff who believes that they are at a heightened risk and will be able to access testing if judged appropriate. And I would just like to emphasise that you do not have to be symptomatic in order to access that testing. If you feel that you are concerned that you've been, you've had an interaction where that is giving you concern, you do not have to be symptomatic, and you can contact HR at Police Scotland, and you can access that testing. So we are ensuring that Police Scotland continue to have priority access to this testing, and the testing of police officers and staff is important, and it will continue as long as necessary.
And Fulton McGregor.
Thank you, Presiding Officer. Police officers have performed a crucial role during the first phase of the COVID-19 emergency, and it is right for the Minister to state clearly that no police officer should be the victim of abuse or violence while at work. Can she outline to what extent the public has confidence in policing in Scotland during the coronavirus pandemic?
Minister.
So the SPA published the initial results from their new public opinion survey last week, and this indicates a strong level of public confidence and also consent for Police Scotland, and this was during the first phase of the COVID-19 emergency. So the SPA report that public confidence in policing in Scotland was higher in April 2020 than when compared with the last Scottish Crime and Justice Survey, and that was 2017-18, and that public support for the approach taken by policing in Scotland to the COVID-19 emergency is higher than a recent YouGov survey finding for Great Britain.
Thank you very much. Question number 3, Monica Lennon.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide clarification on the current COVID-19 testing policy for people being discharged from hospital to care homes and what clinical guidance is currently in place for care homes.
Cabinet Secretary Jean Freeman.
The current COVID-19 testing policy for people being discharged from hospital to care homes is twofold. If a patient has been in hospital because of the virus, they should give 2 negative tests before discharge. Tests should be taken at least 24 hours apart and preferably within 48 hours of discharge. If a patient was not in hospital because of the virus, a single test is required to be taken 48 hours before discharge. For this patient, they should be isolated for 14 days from the date of discharge. All other admissions from the community should have 1 test performed before or on admission to a care home and be isolated for 14 days. This is the HPS Health Protection Scotland guidance, most recently of 1st of May. In addition to this, the Chief Medical Officer and Chief Nursing Officer have published clinical and practice guidance, which provides additional practice-based information on preventing and managing COVID in care homes. This was first published on the 13th of March and has been updated since. The guidance is again being updated to take account of new requirements. This draft updated guidance is what was published in error on the 8th of May before it had been agreed by the Chief Medical Officer and me.
Monica Lennon.
I thank the Cabinet Secretary for her answer. The guidance that was issued on Friday, or published on Friday, watered down the earlier guidance from Health Protection Scotland by stating patients should ideally have 2 negative tests before discharge. The Chief Nursing Officer tweeted about that guidance on Saturday, only for the Cabinet Secretary to tell the media the following day that that had been issued in error, and it was subsequently withdrawn from the government website on Sunday. However, 2 days later, an error message still remains in place on the website. Does the Cabinet Secretary understand that that looks chaotic and confusing to those of us on the outside? And what steps has she taken over the last few days to provide clarity to clinicians and frontline workers who received a letter on Friday with that guidance, and importantly to families over the past few days?
Cabinet Secretary.
So, let me repeat, the guidance that was published on the 8th of May was draft guidance. And so what it says is not currently the policy of government. The policy of government is what I have just read out from Health Protection Scotland. That is the policy position turned into guidance for care homes and care home staff, residents, relatives and care home owners, and indeed to our clinicians in a hospital setting about what should be the testing approach undertaken for patients being discharged from hospital to a care home or community admissions into a care home. So the guidance that appeared on the website on the 8th of May was draft guidance. It was an error that it was published. It has, as you say, been withdrawn. I'm grateful to Ms Lennon for this as a further opportunity to make clear what the testing policy is in this chamber. I know that officials have been in touch with care homes and with others to ensure that they understand that the current guidance is that guidance that was published on the 13th of March, updated again in some measure on the 26th of March, and that they are aware from the 1st of May, as they were, about the changes in testing policy for admissions to care homes, be it from hospital or be it from the community. The revised, updated guidance will be published as soon as it has reached the requirements of the Chief Medical Officer and myself to all the changes that we have instituted to ensure that we have that focus on this COVID situation in our care homes.
Monica Lennon.
I'm grateful to the Cabinet Secretary for that answer, and I stand to be corrected, but I don't believe that the guidance said drafts when it appeared on the website on Friday, and I wonder why draft guidance would be sent to thousands of care providers, to local authorities, to health boards and to IJBs and so on. So it would be good to get some clarification. However, what I am certain of is that thousands of people across Scotland are very concerned about their loved ones who are in care homes or who might be admitted to care homes. There's a feeling still that testing is too slow, there's not enough testing, and that results are actually taking too long. But can I ask the Cabinet Secretary, does she believe that any care home residents have died after contracting COVID-19 from discharged patients? And if so, what lessons are being learned?
Cabinet Secretary.
So let me repeat. Publishing that guidance on the government's website was an error. It's not a conspiracy, it was a mistake. It was a mistake made by people who have been working non-stop on this in the Health Directory since the turn of the year. It was a mistake. And I have apologised for that, and we have made sure that all of those who might be affected in terms of applying the policy know what the policy is, and we will publish the revised guidance when it meets the requirements of the Chief Medical Officer and the clinicians involved and myself. In terms of the overall position on testing, we are working very hard. As the Deputy First Minister said earlier, our capacity for testing has increased significantly. It still needs to increase further, I should say, in order to meet what we need for the full test, trace, isolate, support strategy that will be critical to any easing of the current measures. But it has increased significantly. Our work now is not only to continue to increase the capacity, but to increase its use, and that involves speeding up the turnaround time for testing, and that's the whole turnaround time from the point when the sample is taken to the point when the result is given. Now, at the moment, that ranges between 4 hours and 48 hours. That isn't good enough. The advice that I have from clinicians is that it should be 24. If we can bring it in under 24 for test, trace, isolate and support, that will be very helpful, but it needs to be at the 24 end as the top end. So that is the work that is now underway to work out the logistics of making sure that when samples are taken, A, they're taken quickly, and B, they get to the labs as quickly as they need to, and that in the laboratories we have all that we need to process that sample. So that's the equipment, that's the chemical reagents, that's all of that, and that we now have a good solid supply line for all of that. That supply line is a bit like PPE in that lots of people globally are after the same supply line, and I'm very pleased that my colleague Mr McKee is also now working with us on that, as he has done so helpfully on PPE. So that is the work that is underway in order to speed up the turnaround time on testing. Now,
Cabinet Secretary, we have two more questions. We have two more questions in this.
I do not know, I cannot know if any of the residents in care homes who contracted COVID-19 did that as a consequence of any admission that may have had COVID-19. I do not know that. And the reason I cannot know that is because the incubation period, the length of the incubation period, and not knowing exactly what individuals may or may not have had before we instituted this testing policy.
Thank you. Miles Briggs to be followed by Willie Rennie. Miles Briggs.
Thank you, Presiding Officer. Care homes are reporting that only 30% of staff have been able to access testing. Yesterday, the Scottish Government reported that only 3,584 tests were carried out in NHS, community, care home and mobile settings. Yet the capacity in labs is over 8,350. Why are we not seeing increased testing within care homes? And when will all care home staff in Scotland actually have been tested? Because we are now knowing reports of asymptomatic members of staff testing positive.
Cabinet Secretary.
So the latest figures I have is that of all the key workers tested, 32% of those were social care staff or their household members. There is no barrier to social care staff being tested, and that is being promoted by us, I hope by care home owners, certainly by local authority partners, to their home care staff. And as Mr Briggs knows, the policy now is, in a care home with an active case, to test all residents and all staff and to undertake sample testing in care homes where there is no active case, so that we can keep an eye on what is happening there. All of that effort is designed to use the maximum that we can in that area and in other areas where testing is important, to make sure that we use the capacity that we have to the best effect.
Thank you. Willie Rennie.
My interest is in community admissions to care homes. Surely we should always be testing before the admission to the care home, not in some cases, as the Minister has indicated, that after the admission to the care home. Surely the whole purpose of this is to stop the virus, if at all possible, from getting into the care homes. So why can't this be done in all cases?
Cabinet Secretary.
So testing is a really important part of preventing the virus in any setting and ensuring that it is not transmitted. But it is not the only thing. Of itself, it will not do that job for us. That is why admissions to care homes, in the case of the individual coming out of hospital, they've not been in hospital for a COVID reason, or a community admission, requires 14 days isolation, in order to ensure that if they develop symptoms of the virus, they are isolated, proper infection prevention and control nursing is in place, and so the transmission is not possible from one resident to the other. Of course, PPE is a big part of that. The other point I need to make is that the individuals very often in care homes or being admitted to care homes are frail, they're elderly, many of them have dementia. For many of them, the taking of the sample to test is a distressing experience and can be one that is not possible to take at the ideal time frame in which you might want to take it. Isolating individuals in the care home for those first 14 days allows the possibility of the test being retaken if it wasn't possible before their admission. All of that is designed to ensure that we maximise the protection of that resident, but also of staff and other residents against the virus and the transmission of the virus.